Shukla Medical. When it comes to orthopedic revision surgery, we are the extraction experts. The Shukla Hip Universal Hip Stem Extraction System is designed for the removal of hip stems during revision surgeries. This includes tapered neck, monoblock, proximally threaded, slotted, and cross-hole stems. The system includes 20 different sizes of thread extractor tips that can be used to engage proximally to a threaded hip stem for extraction. Both standard and metric thread sizes are included. Also in the tray is the Shukla hip stem extractor. This extractor will clamp onto the trunnion of a hip stem to facilitate successful hip stem removals. The femoral head punch can be positioned under the femoral head to dislodge it prior to stem extraction. Both a monoblock and a hook extractor are also included as available removal options in the Shukla hip system. The system includes a connector shaft for the threaded extractors and monoblock and hook extractors. Also, an optional stubby driver can be included to help with disassembly and reassembly of the stem extractor. Hex nuts are provided for connection to the strike plate frame along with 2 double open-ended wrenches. In addition, the hip system includes a Hudson T-handle, mallet, strike plate frame, and an optional modular T-handle. The monoblock extractor must be assembled to use for extraction. To extract a monoblock hip stem, connect the monoblock extractor with the shaft driver. To use the hook extractor for hip stem removal, it must be connected with the shaft driver. The threaded extractor tips connect to the same shaft drivers to be used for extraction. This allows all 3 removal methods to connect to the strike plate frame. Position the punch against the femoral head and onto the hip implant neck. Use the mallet to strike the impact cap of the femoral head punch to dislodge the femoral head from the implant. Once the femoral head is removed, the hip stem extractor can be used.
With the handle in the open position, slide the hip stem extractor over the neck of the implant as far as possible while avoiding the curved portion. If there is a lip, slide it down past that. Rotate the extractor handle counterclockwise to loosen the jaw if needed. Once in position, rotate the extractor handle clockwise to tighten the jaw around the neck of the implant. Then, press the handle down towards the extractor body until it locks closed. With the extractor aligned and properly secured, slide the strike plate frame onto the proximal end of the extractor and secure it in place with a hex nut and tighten it with a wrench. Extract the implant by impacting on the strike plate frame until successful removal. For threaded extraction, determine the size of the threaded implant and connect the correct tip with a shaft driver. Attach the T-handle to the shaft driver assembly and thread it onto the implant. Remove the T-handle from the shaft driver and slide the strike plate frame over the shaft driver. Secure it in place with a hex nut and tighten it with a wrench. Extract the implant with repeated strikes of the mallet on the strike plate frame. For a monoblock hip stem, take the monoblock extractor and shaft driver assembly and connect it to the strike plate frame with a hex nut and secure it with a wrench. Place the extractor assembly under the femoral head and impact the strike plate frame with the mallet to remove. For slotted stem extraction, use the hook extractor and shaft driver assembly attached to the strike plate frame and remove it with a mallet. Also available from Shukla Medical.